Hello, everybody, and welcome to the Northeast Regional Report Out Call. We're here every Tuesday at 2 o'clock. This is our sixth week of doing this. It's January 19th, and we've got an action-packed half hour for you again here. So I'm John Rolfe. I chair these meetings, and we'll go through our normal repertoire of reading through the dashboard that our friends at the Kansas Hospital Association put together for us. Then we'll hear from public health and from hospitals. We have a guest from Wamego here with us today. And then we have Dr. Watson who will talk about the transfer situation, and Dr. Duvey who will talk about testing. So we got a good meeting here ahead of us. And without further ado, I'll get to our dashboard, but I do want to remind you here that you can, I need, Megan, I need the ability to share my screen if I can. You can sign up for emails here at covid.ks. Whoops, sorry, I took only a half step there. covid.ks /report-outs. This is the website here, covid.ks /report-outs. Put in your email address, sign up for your region here in the Northeast. And you'll get an email with the dashboards and with the video. You can see the map and the archives here of all the past weeks. So do that. Here's our dashboard for the Northeast region for this week. Generally good news, and we're seeing generally good news across the state right now. You'll see here of the 21 hospitals, only 3 anticipate staffing shortages. This is still an issue out there, but it is one that's improving across the state. We bring this up as Sarah has taught us. It's staffing, stuff, or space that's generally a pinch point for a hospital, and this has been the pinch point the last couple months here. So hey, when we come across hospitalized COVID or suspected COVID patients, we're from 161 last week to 135 this week. That's going in the right direction for sure. Those in the ICU with COVID or suspected COVID from 29 down to 21. Then move over to the numbers you want to see go up. Adult staff available ICU beds up to 30 from 27 last week, 30 this week, which has gotten us from 23% capacity to 27% capacity there. That's good. And then coming down here, you can see what's happened with the caseloads. We were a little worried we might be seeing a rise here last week. And we did come back down to 2,700, down from 3,700 of new cases in the past week. So all that is telling a good story. Certainly not out of the weeds. We'd love to be back where we were in October, still elevated levels and near capacity, but we're moving in the right direction. So keep up what we're doing. Then here on the second page, you can see the percent of the population from each of these counties that's gotten COVID and our census of our COVID, non-COVID, and available ICU beds here. So that's good. And then I'm going to flip over while I got the screen. Also, we talked about this last week. If you go to kansasvaccine.gov, remember vaccine has 2 C's, kansasvaccine.gov, and click on vaccine data. Dashboard's up. Just remember, it does lag reality a little bit. So you can see how many doses have come into the state from the feds. And as people get it entered into the system, I know we're north of 125,000 actually at this point from Dr. Norman, but how that's going, first versus second doses and percent of the population that we've been able to get to. And then, it's interesting, just Pfizer versus Moderna, how much has been able to get out. Moderna obviously started a week later, so Pfizer kind of had a head start. But then I like this one too, where you can see first doses, second doses here as we kind of move through this. So good data. I know they're going to be expanding on this, but if you want to follow what's going on with the vaccine, kansasvaccine.gov. Okay, there we go. Let's kick it over to Jen in public health. Give us her feedback there. And Jen, you're muted. There we go. Thank you.
Hi, yeah, so I'm Jen from the Lawrence Douglas County Public Health Department, and we're seeing some really good movement in our case counts. We like to see the numbers go down, and we're seeing that right now. So we're seeing people engaging in behaviors that are supportive of our measures right now. They're wearing masks, they're socially distancing. If they have gatherings, they're outside, and we've been very lucky to have a mild winter so people can spend time outside. I think that's making a huge difference for us right now. On the vaccine front, We definitely have given out our doses as quick as we receive them. So we are moving and grooving with that. And as soon as we get more, we will eagerly go into the next phase as soon as KDHE tells us to, because that's the most exciting thing that we can think of right now.
That's great. Good update. And, we do hope as we're kind of rounding the corner on phase one that we'll be able to move into phase two in the next week or so. And that will the phase two block is much larger than the phase one block. And the amount of vaccine that we're getting from the feds is not what we would have hoped. So it will take a while to get through phase two. So just to encourage people to have patience and have that expectation that, you may have 100,000 people that qualify and you may get 2,000 doses a week kind of thing. So, but what you'll hear from in the coming week as we round into phase two would be, the state moving us there. And then you really want to pay attention to your local county health departments. They're going to tell you how to get in line and how it's going to be processed in your county. So really be paying close attention to your county health department, which we already hope you pay attention to your county health department. But this is a time you're really going to be leaning in there. Okay, let me kick it over to our friend Sarah.
Hi, John. Thanks for having me. My name is Sarah Gideon. I'm with the Health Innovation Network of Kansas. On a day-to-day basis, I work with 16 hospitals, and for the purpose of these calls, work with about 23 counties in Northeast Kansas. So we are, as John said, we're starting to see the numbers of our cases as well as our hospitalizations declining. Some in part due to the increased messaging around our public health measures that Jennifer just spoke of the covering your face and maintaining your distance and doing the things that we need to do to keep ourselves and to keep others healthy. Additionally, we're also seeing use of treatments that limit our hospitalizations, like our monoclonal antibodies, enhanced primary care, and some other models that we're using to try to limit the need for hospitalization in our COVID patients. I did have one bit of good news that I wanted to share. I had one hospital that I spoke to today. Today is the first time since May 7th that they have had they've had none of their staff members out due to COVID. So it's a small hospital with less than 150 full-time employees. Having employees out is very impactful on the ability to care for their friends and neighbors that seek care at this facility. So they were really able to celebrate having this milestone today. We are starting to see a few less of the transfer issues. I know Dr. Watson will speak to that. But we are still seeing some transfers from outside of our normal region for patients that are needing care. With that, I'd like to turn it over to Steve Land. He's the administrator for the Wamego Health Center in Wamego, Kansas. So Steve, thanks for joining us today.
I have to remember to unmute myself. I apologize. Hi, Sarah. It's great to see you, and I appreciate the opportunity to visit with this group today. My name is Steve Land. I'm the administrator at Wamego Health Center. And for those of you on the call that are not familiar with Wamego, we are geographically located between Manhattan and Topeka along Highway 24, positioned in the southwest portion of Pottawatomie County. The other hospital system in our county is Community Healthcare Systems, which has facilities in both Omega and St. Mary's. Wamego Health Center is a joint venture between Ascension Healthcare and the city of Wamego, and I like to say that we have the best of both worlds when it comes to healthcare. We have the national perspective with Ascension Healthcare, and then we have the desire for success from our local partners at the city of Wamego, which is a nice balance for us. The access to PPE and equipment throughout this pandemic has been one of the many blessings that we've experienced in being affiliated with Ascension throughout. So that has been very helpful. Wamego Health Center is a 17-bed facility. Our inpatient census typically runs around 6 to 9 patients, with our COVID numbers varying quite a bit within that range. We've been anywhere from 5 positive COVID patients at any one time to a day where we had 0 PUIs and 0 positives on the floor. Today, we just happen to have 1 positive COVID with a total inpatient census of 7. And I don't know if this variability in patient types is easier or harder on our staff, to adjust frequently to those changes. in the census and precautions, but I can say that our staff has done remarkably well. We currently have one staff member who's out on COVID restrictions right now within our nursing department. Otherwise, everybody is here and healthy. Our testing rate historically for the past 3 months has been around 10 to 20 tests per day. We implemented an outdoor testing area, which has served us very well ever since the beginning of the pandemic. Patients that we test primarily for COVID at this time are either symptomatic patients or inpatient transfers that are going to another facility. We very rarely test asymptomatic patients here. So our testing positivity rate for the last 6 weeks has ranged anywhere from 8.5% up to 37%, with the average being about 23.4%. And we typically see a higher positivity rate at Wamego Health Center than what we see reported through KDHE because we don't test those asymptomatic patients. Based on our location, we have a lot of asymptomatic testing that takes place both in Manhattan and Topeka, which we're very, very grateful for, and that seems to offload some of the need for that within our community, but we're very grateful for that. Pottawatomie County currently has 56 active cases, 5 COVID patients that are hospitalized, and we've recorded 8 deaths in Pot County due to COVID. Our highest 2-week new case rolling total occurred on January 5th when we had 151 new cases from a 2-week total, and this was in large part due to a spike in a 9-day period between December 23rd and December 31st when we saw 105 new cases in that 9-day period. We have since seen that number drop off to a 2-week total of 86 currently, so that's nice to see, particularly when we didn't know after the holidays where we would wind up and what the impact was going to be with the get-togethers. One of our most critical infrastructure pieces for Wamego Health Center, as with any critical access hospital, is our ability to transfer patients, not only COVID patients, but our critical patients. And our referral patterns typically consist of Manhattan and Topeka. I've got to say that the scorecards from the facilities that have reported their patient data has been critical in our ability to make decisions and have that pulse on where things are at within our region. Not only for transfers, but that information has been important for us in order to speak with good confidence to our city and county officials, our school leaders, our local health department, and other facilities in regards to both our local and regional decisions. So I wanted to take a second and thank those organizations that have supplied those scorecards. That data has been extremely important to us. And then from a vaccination perspective, we have had a 72% acceptance rate for the vaccine, with another 10 to 15% voicing that they want to wait to see what other people, how they respond, and then another smaller percent that's just, at this time, just a no. So that gives a total of 138 vaccines to date, 58 of our associates having received their second dose, and 22 that are scheduled for that second dose in the coming week. So with that, I'll pause and see if I can answer any questions about Wamego Health Center.
Hey, Steve, thank you. I'll tell you, Wamego Healthcare has a special place in my heart. I had a traveling nurse from Wamego that helped deliver our last baby.
Wow.
So, yeah,
Good.
did you all proud, just letting you know.
Very good. I'm glad to hear that.
Yeah, 10 fingers, 10 toes. Anyway, any questions for Steve? I appreciate that. Was a really good report out.
Yeah, thank you very much for the group.
Let's pass it over to Dr. Watson. We've heard transfers come up a couple times, so he can show us the board. Dr. Watson with Mission Control and China Mountain Software.
Yeah, great, and thanks. Certainly, it is better news each week, it seems like. And John, if you give me the
Oh,
screen
sorry
share,
about that. Yeah, my bad.
That this week especially, I think we've monitored, particularly over the last few days, understanding where we're at. Just a lot of yellow on this screen where it's usually red. We're starting to see green even, meaning that there is capacity in the system, and that while a lot of these are still case by case or critical capacity, we're not at no capacity. And the Kansas City metro region has seemed to unload a lot faster than some of the other regions. And we think that's been a great advantage to moving people through the state. We do know that this region has still had some protracted times, as was said before, but the actual numbers are less and the number of COVID positives are less. So overall, I think half the requests that we get in are also asking for a bed. 30% are COVID positives. And then the time to get a transfer is still a little elevated, particularly on the COVID side. We're seeing even upwards to 3.5 hours in this region for some of these transfers. So obviously this is data that's coming out of a week ago. We're easing up a lot on this, and that's what I'm saying. It's seeming to unload a lot more quickly in this region from where we were. And certainly those early January numbers were reflective of a pretty critical time up here. And we're seeing a lot of back off on that. So happy to share better news this week than usual, and hopefully it will continue.
Thank you, Dr. Watson. And then we have with us Dr. Duvey from KDHE. She is helping lead our efforts in testing across the state. And she is going to give us an update on the testing strategy for Kansas. Dr. Duvey. Oh, and you're muted. Yep.
Once again. Thanks very much, John. And thank you, Steve, for the shout out about the community testing partners. We think that community testing is really critical to really stay ahead of the game here with COVID. So I'd like to just give you a little update about testing. And one of the things that we're very proud of is that since the beginning of the pandemic, we have in Kansas actually processed 2 million tests and tested more than 1 million Kansans. So we still have some work to do, but I think that's really good to keep in front of us, all the work that we have already done. So today I'm going to try to address a couple of areas that John thought you might all be interested in. What role does testing play in the response to COVID? Where can I find a testing site? How is our testing strategy evolving? And where can you be helpful here? So I gotta find my arrow, there it is. So testing is really a critical tool to manage the impacts of the pandemic, as I'm sure you're all aware. Using testing, we can help reduce the spread by identifying people who are COVID positive. We can get them isolated and hopefully keep their friends, family, loved ones safe, and prevent them from sharing COVID with those in their close environment. Also reducing community spread, which is critical. I can't tell you how many people I've come across that have tested positive for COVID and they have no idea where they have been, even near somebody who is positive. So really critical with 50% of people who are infected with COVID not having any symptoms to really know your status here with COVID. Protecting at-risk populations like the elderly and people with underlying medical conditions like diabetes or a cancer or other high-risk conditions. So really providing testing to caregivers, testing to the workforce in our long-term care facilities, and testing to those individuals with at-risk medical conditions. So if they are positive, we can get them access to treatment as soon as possible, but also to their family members to help protect the folks that they live with. So identifying those who are symptomatic and testing to make sure that we find COVID if it's there. I heard somebody mention monoclonal antibody treatment. So that is, available to people outpatient, hopefully keeping people from needing to get hospitalized with COVID, but also treatment for those individuals who do present at the hospital and are identified with COVID. The earlier we can identify people, the sooner we can get them treated and hopefully prevent them from progressing to more severe illness. And then finally, the economic recovery, making sure that people feel that it's safe to return to work and to school, because if somebody does have COVID, they'll be identified quickly before the COVID spreads to others in that environment. And then restoring our confidence and just doing what we need to do on a daily basis, taking our kids or family members to a healthcare provider, or even going to the grocery store. So testing it has been an important tool, and it's going to continue to be an important tool. Even as we begin to vaccinate members of the community, we will need to identify where there is COVID, get people isolated, and prevent it from spreading in the community until we reach that point in vaccination where there is herd immunity, and we can feel more protected. So where can you get tested? You can see that the Test All Kansans, the community testing initiative, really is spread far and wide across the state. The green sites are mass testing sites that are run by vendors, where you can go. Don't need an appointment, but it's helpful if you can get one. Go to gogettested.com, and you can find the closest testing site to your community. There should be no charge at all for any of these testing sites. Community testing partner sites include our federally qualified health centers and hospital partners, and then your local health department public health testing sites are in yellow. There are some mobile testing units as well that go from site to site and do testing in those more rural communities. You can see that there remain a lot of testing gaps across the state of Kansas, and this is something that we have paid close attention to, and we are working to mitigate, actually. So we really would love to improve testing access by partnering with local organizations. We want to expand support for our community testing partner program. And we, in particular, are looking to leverage testing partners in those counties without testing access currently. Now, I know that there are healthcare providers who are doing testing. There are other ways to get testing in a community, but this is, low barrier testing for those individuals who are interested, who may think they had an exposure, may feel like they would like to know their status. They may or may not have symptoms. Anybody can come and get testing at these sites. We have developed a menu of options for local health departments because we know there's not a one-size-fits-all response to testing needs in the community. We are engaging more with local organizations, including, importantly, faith-based organizations, those trusted partners in the community where people will feel comfortable and confident about going to get tested. And the KDHE, KHEL, is actually piloting a mobile van testing response to really allow agile deployments when needed if there's an outbreak in a community, or if surveillance methodologies show that perhaps there is ongoing viral transmission in the community. We can send in a mobile testing van and really direct testing where it's going to have high yield. And then we're piloting mail-in saliva kits with local health departments. So the saliva kits will be drop shipped to local health departments. Local health departments can hand them out to people who call requesting testing. They may use those to sponsor testing, community testing events, school testing, for example, or testing events at a local venue. And then we'd like to improve the patient experience. We know there have been some concerns in some communities about turnaround times and about some concerns about the testing experience. So we're working really hard with our testing partners, our vendors, to really improve that experience. We're partnering now with Kansas Labs to reduce that turnaround time, eliminating the transit time for those labs, and hopefully getting those results back within 48 hours to those who've been tested. And then also dispensing rapid antigen tests across the state to local health departments and other community testing partners. So, and then the mobile response, the mobile van actually to respond, as we talked about, to areas of concern. Really important to expand testing into those rural communities. that didn't have testing opportunities. So we would love for you to continue to partner with KDHE to drive testing in your county or your region, be our eyes and ears on the ground, provide feedback, leverage those relationships in your community, the trust that you have engendered in your community to help get this message out about the importance of ongoing testing. We've got to drive testing and vaccination simultaneously. And hopefully we'll see the light at the end of the tunnel here pretty quickly. So if you have questions, you can always call the KDHE COVID call center. You can contact your local health department. If you have a question about the Kansas Department of Health lab, there's a website there, and there's an underscore there between KHEL and help, which got obliviated. And then if you have a question or a comment about a Well Health testing site, you can call the Well Health number.
Thank you, Dr. Duvey. Appreciate it. You cover a lot there for us, and obviously testing is still important. We're running low on time. We like to end with a bright spot. Bright spot here out of K-State, just using the information they were gathering on quarantining athletes helped move the CDC, contributed to their change on the quarantine guidelines. So it's great to see. I'm apologize, Kyle, but Dr. Kyle Gorel, that's what I'm going to say, helped co-author the study that the CDC took in and used as part of the consideration. So great to see folks from the area contributing to the national guidelines on all that. Thank you, Dr. Duvey, Dr. Watson, Jen, Sarah, Steve from Wamego. We're grateful to have all of you guys here with us this week. We'll be back next week, hopefully with more information on vaccine and with what's going on with COVID in your state. Glad we had good news for this week, and thank you for everybody for participating. We'll see you this time next